You're listening to Evergreen Media Network. I am Cindy Schwartz, and this is the Patient Partner Show. We're a podcast on Spreaker also, so look us up on that. Jeannie Roller is my co-host. Jeannie Roller, today we're talking about how men are not being allowed as prevalently into the nursing profession from what this article you're telling me about says. The gentleman that has written the article is a nurse himself, was definitely hands-on ward nurse, and he also is now in the training field. And I think it's a great article that explains a bunch of things on why men want to get into the nursing field. But then on the other side, too, we go back, and I said this to you before we went on air, we go back to the fact that in the day, and now it's different, that women weren't necessarily allowed. They weren't allowed to go to medical school. They couldn't be doctors. So nurses were, I don't want to say second-class citizens, but a second effect to what the medical profession was as doctors, if you will. Now it seems like it's the reverse. The men are having a difficult time to break in, if you will, into the nursing profession, which it's a totally valid point if that's happening. And also it's valid that we need males in the nursing profession for certain avenues of nursing. Absolutely. We talk about that all the time. Back in however many years ago, 30, 40, 50 years, there were male orderlies that specifically geared their practicing their skills towards male patients. And then you had female nurses that kind of that did take care of both male and female patients. In intimate procedures, male orderlies they tried to use, and in intimate procedures for females, female nurses. Now it's kind of an open book, if you will, that everybody is looking to do every avenue of nursing. I don't agree with that because I know myself personally, I would only seek out female doctors because of things that have happened. I've seen there's just not a lot of regulation on some of the things, all the stories that you and I have talked about on this podcast where you can't really, when you're the patient that's out on anesthesia or whatever, you don't know what's going on, and to trust the things that we've seen and had happen to us, it's tough to do. But let's talk about that, Jeannie, about what this gentleman is talking about on why there needs to be more male nurses and why it needs to be more readily available.
Well, the Labor Department predicts that up until the year 2032, there will be 193,000 nurse job openings per year, but they predict that only 177,400 will enter the workforce. So there is a shortage over, the coming decade of nurses. And they said that as of 2022, only 12% of the 3.1 million nurses were men. Mm-hmm. So that's only 372,000 nurses that are men. So, there is a gender gap in nursing. Nursing has primarily been thought of as a woman's field. Mm-hmm. I know I've read several articles about men who want to become nurses talking about how biased the nursing schools are against them. Even the nursing students and the nursing instructors seem to pick on the male students. I know that a lot of people wouldn't want a male nurse. And, a lot of these stories, Cindy, that we talk about of sexual abuse, sexual assault, are male nurses with female patients. So, there is a worry there. But for my husband, he would rather now have a male nurse because he had issue with female nurses. Right. So he won't accept a female nurse for intimate care. So, there is a need. I think that there needs to be better guidance. Mm-hmm. There has to be some safety things put in place so that, that the sexual assault thing on both sides, male and female, doesn't keep happening, because nurses are more likely to be alone with a patient. They are more likely to be alone, for a period of time and have the opportunity. So, we really have to watch that. A lot of men, aren't interested in nursing because they don't want to be labeled as, being outside of what everyone thinks is normal.
Right.
But the
Yeah.
pay for nursing is good.
Yeah.
The time, it is all good. It is a profession that, if you want to move out of state, you can go out of
Mhm.
state and get practically the same job, maybe more, even more pay.
Right.
So, I mean, there's plenty of reason to become a nurse, I would think. But, they aren't really doing a whole lot to attract men into the nursing field. That's the worrisome thing, because there is a shortage, and there will continue to be a shortage of nurses into the foreseeable future. So they need to do something, because nurses now, that's one complaint that we hear, is they have too many patients
Right.
assigned to them
Yeah.
per shift.
Mhm.
So, they need to get these people in here and get them busy.
Well, a lot of the different strikes and stuff recently, we've read them after COVID, before COVID, whenever, was the patient care and the amount of money that they make. But you're right, it is a good salary. I don't know what the conundrum of it is. It shouldn't be prejudicial, but it should also be. We're going back to the same topic, where you got to vet these people too. I mean, you want to know that person that's in charge of your care is, the best possible person can be for that situation. Where has it come to the fact that it's just run of the mill? It's like an oil change situation. You just drive in 10 minutes later, it's a 10 minutes oil change situation. We just did the podcast about how that facility didn't do anything with that doctor who was ordering and performing illegal operations, if you will. Women didn't need hysterectomies. He gave them to them anyway.
Right.
Look at all the stuff he was doing. That's one, it's one facility, but that's not the only one. We talk so many times, too, of the stories that have gotten out in the open, if you will. There's 100 behind them, in our opinions, that don't make it out there. We don't do this. This isn't happening. Where are you getting this information from? They tell us collectively. No, this doesn't happen. And then you'll read a story. I've talked with police officers that were literally crying when they wanted to give charges to a doctor, a heart doctor that was molesting his female patients. They said, we know that this happened. We don't have any laws on our books in the state where this is happening that we can do any more stringent charges on this doctor than blah, 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 blah. And the officer that I was talking to was crying. Look at these women that have been abused, and you go in there for medical care. That's not an isolated incident, and that's what that police officer said. This is not isolated. We know that. This is just one that happened. Right. 25 women complained, so somebody's got to listen. What happens to the one that's infrequent here? Oh, we're going to do this one, that one, this one. And don't tell me that it doesn't happen, because it does. And who are the people that you go to? Who are the people that you go to? Because we never found them. We didn't.
Yeah. No. Well, that's the thing about vetting. You just can't vet them once and be done. It has to be some sort of continual process, because you look at these people who do these crimes, it is over a long period of time.
Yes.
It is just not like they did it one day to 20 people. It is sometimes 20, 30 years worth of crime.
And
the vetting system, we need more men as nurses. I agree.
Totally.
But we also need to be careful with both female and males as nurses, because it's patient safety, and a lot of times patients don't even know that they've been harmed.
Right.
So.
We've read so many of those stories too. And the other thing that we've read and we've heard so many times is how discriminatory it is not to allow these nurses to do blah, 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 blah. It also, and I want to say this, and it's discrimination against the patient too, to force this kind of stuff on the patient. It's not just a one-way street. It's a two-way street. We have rights too as patients. Just because you have given us an informed consent paper, which have become willy-nilly, it doesn't mean we're consenting to all kinds of abuse either. These are all our opinions. No. On that note, stay listening to Evergreen Media Network.